At Opal Healthcare, we believe language is important, so you might notice we use words a little differently. For example, we say care community to describe residential aged care homes. So instead of saying facility or home in this video, you'll hear us using the term care community. We know that the aged care fee structure is complex, almost like a puzzle. Don't worry, we're here to guide you through a few key moves. It's important to know that the government decides how much you or your loved ones will pay for residential aged care. The more means you have, the more you will pay. To be eligible for government support, you need to complete a combined assets and income assessment with the Department of Human Services. This involves answering questions to determine how much support you or your loved one will receive from the government. If you need to find aged care in a hurry, you can use the government's fee calculator to help you estimate the likely costs of care. An independent financial advisor can help you make decisions that are right for you. And remember, while your financial circumstances might impact your choice of accommodation, it shouldn't change the standard of your care. Now, there are 3 types of residents. The government may assess you as capable of funding your own aged care, or you may be eligible to receive partial assistance. Some people are eligible to have all their costs covered, except for the basic daily care fee, which everyone pays. Almost every aged care community allocates a proportion of beds to government-supported residents. It's important to discuss this up front so you can focus your search on care communities that can accommodate your financial situation. There are 4 types of fees you need to know about. Let's take a look at each one in a little more detail. The accommodation fees set by the individual care community is going to be your most significant cost. You can pay for these in 3 different ways. The Refundable Accommodation Deposit, or RAD, is a single lump sum payment for your accommodation. The RAD is completely refundable should you leave the care community for any reason. Or you can pay a daily accommodation payment, or DAP, which is a rent-style equivalent using a daily interest payment on the full room price. These payments are not refundable. And the third method of payment is a combination of a RAD and a DAP. If you're partially supported by the government, they will ask you to contribute to your accommodation costs. The contribution amount is determined by the government. Costs of meals, cleaning, laundry, heating and cooling are covered by a basic daily care fee. Everyone pays this fee, which is determined by the government and set at 85% of the single age pension. The means-tested care fee ensures that residents who have more means share the cost of their care with the government. You can find out if you have to pay this fee and how much by submitting your combined assets and income assessment. Or you can estimate your fee by using the fee calculator while you wait for the final determination from your assessment. Some care communities offer additional services or extra services. Make sure you ask about the cost and conditions of these services before signing any agreements. There are many pieces in the puzzle to find the right aged care solution for you. Being well informed and asking the right questions will help you find the care community that suits you best. And remember, we're always here for you. For more information, including the handy fee calculator, visit opalhealthcare.com.au or call us.